Hello and welcome to the Breast Cancer Rehabilitation and Wellness Summit. My name is Denise Stewart, and today I want to talk to you about why I think it's important to investigate the area of the serratus anterior and the skin above it. And I think that this is often missed. I want people not to miss or dismiss serratus anterior. So let me delve into this a little bit more deeply as to explain why I think this area is important. So firstly, let's look at where serratus anterior is. It's absolutely on the side seam of your body. And so it's on what they call the lateral chest. And so there is, if I can just show you with my little arrow, the pec muscles come onto the front of the chest. The lats are on the back of the armpit and they go onto the back of your body. And right here into the armpit, covering the rib cage, is serratus anterior. So that's where you feel it, but it actually extends underneath the breast tissue and then goes underneath, back to the back, underneath the shoulder blade. So I did a little freaky art thing, and it doesn't do it justice, but you know, this is what I could do. This is my little skeleton. Here is, we're looking at the side view, so the side of the chest. There's the shoulder blade at the back, the collarbone at the front, and over here is your chest bone, the sternum. So the most part of the muscle is on the side, goes underneath the shoulder blade this way, and then attaches onto each of these ribs, onto the side of your body. So this is almost underneath the breast tissue. This is below the tip of the breast. So if you have a look from the back, so it goes underneath the shoulder blade and then attaches on the underside of this part of the bone. So the underside of that. So, you know, I've got my little arrows that's underneath there. So that's where it is. Now I'm going to talk about why I think serratus anterior needs to be in good working order. And it's for many reasons. So we need a serratus anterior in good working order so that we breathe properly. So when we take a breath, because you saw where it attached on the rib cages and the shoulder blade, then when we take a breath, it doesn't need to be limited, but if there's a tightness in that muscle, then when you take a breath, a big breath in, then it'll feel like it catches, that you get that a sense of discomfort around the shoulder blade. Another reason why we need it to be in good working order is that when we lie in bed on our side, then we want to be able to do that without pain. But if it's not in good working order, then we lay on the side and it feels really uncomfortable. And I guess that, you know, I miss the most obvious. We need to be in good working order so that we wear anything that's a bit firm on the upper body. And we want to be able to wear those things without pain. But having a tight serratus anterior or one that's not working well, then having something tight on that would make it feel uncomfortable and something like you want to feel like throwing it off. Let's look at this picture. This girl's doing something quite strong with her arms. And so to have a serratus anterior in good working order means that the shoulder blades are well positioned to make the arms work strongly. So it gives good arm strength and good shoulder strength if serratus anterior is in good working order. The other important action of the serratus anterior is to pump lymphatic fluid in its local area. And so it pumps and it creates some energy for the fluid to flow along. And so we want the serratus anterior to be in good working order for the fluid of the lateral chest, so the side of the chest, to be able to pump through into the axilla. If it's not in good working order, then the fluid might just pool around. I'll just talk a little bit about the pain of the area, because if it's in good working order, we don't get pain. But if it's in poor working order, then people would feel pain between the shoulder blades, and usually down lower, so on the towards where the bra runs across, or just above the bra. So if the serratus anterior is in poor working order, then there will be an annoying, nagging pain just without doing anything, and it's often because of poor shoulder blade posture. So the next area I'd like to talk about is why I think that the working order of serratus anterior is affected after breast cancer. So the top reason that it is affected is it affects first of all, it is not specifically to breast cancer. So the top reason is not specific to breast cancer, and it is that we're human beings, and that we are upright, and that we have a shoulder posture and a lifestyle, and especially now, where we're forward working. And so because of our human makeup and because of our lifestyle, then the shoulder is at risk of being in poor posture. And so serratus anterior specifically is at risk of being inhibited. So that's the primary reason. So then let's step through the reasons now specific to breast cancer surgery and radiotherapy. So one of the reasons is because of the changes in the skin. So there's two areas that change with the skin. One is that there's less skin for some people, and so that might be for mastectomy or breast reconstruction. There's a change in there may be a change in the amount of skin. So there's going to be less movement in the surrounding skin. The other is that there can be changes in the skin movement because of radiotherapy. The second area is that there's changes specifically to serratus anterior, so the muscle. So it is in the zone that radiotherapy is placed or targeting. And so the serratus anterior itself undergoes changes. You've heard of the word radiotherapy fibrosis. It does get tighter, and the circulation to that area has to be affected. And so serratus anterior is at risk of having those radiotherapy changes itself. The other specific breast cancer-related reason that serratus anterior can be placed in a situation where its working order is challenged is because of the breast reconstruction. And so if there's an implant, then the implant is directly over the outer edges of the serratus anterior, and so pressure of the implant onto a muscle that is tight can cause problems. And if there was your own body fat or muscle that's placed into the breast reconstruction, then if there's changes in the amount of movement in the skin or in the tissues of the breast, so less movement there, and having less movement nearby will absolutely affect the working order of the serratus anterior. You can see in this example that the changes after mastectomy, you can see the skin has some adherence to the superficial tissues and then the deep tissues. And so in this instance, there's every reason that you can understand that that mastectomy and poor healing can affect the working order of serratus anterior. So let's look at this area in regards to that the skin changes and the lymphatic changes. And so you can see for this lady that it looks like there's less definition in the area. So one may think that there can be either more fat in the area or more fluid in the area or less movement in the tissues in the area. There's not a good definition of the front armpit and the back armpit. So the skin out over the area of serratus anterior has been, looks to be impacted. And I can tell you that there's actually changes in the movement of the skin. So the green arrows are just showing you that it's tighter in the across line, and there's tightness in the down line, the down movement line of the skin. So if there's tightness in the skin and there's changes in the muscle, then one would wonder how effective the lymphatic flow is in this trunk area. Now, I didn't mention this specifically before, but there can be changes to the nerve. And so this can be as a result of the surgery. And let's have a look at the likelihood of this being a problem. And so in this study, there was 36 people who presented with winged scapula. The wing of the scapula is where the bone of the shoulder blade tips out, and so it comes away from the rib cage. And that of that, 30 of those people actually had confirmed changes to the nerve, so that's the long thoracic nerve. And so 27 of them had partial changes and 3 were severe changes in the nerve. And the interesting part of this is that 12 months later is that the EMG showed that the injury persisted for only 6 of those people. So that's only 2% of the patients. So the likelihood of a nerve damage for serratus anterior is there. It's around that 14% in the first year, and it can reduce to 2% in the second year. What I would like to do now is talk about my tips for assessment. So for testing serratus anterior, what I like to do is actually palpate the texture and the density of the muscle and the skin above it and the tissue between the skin and the muscle. And so I use my hands. The second tip that I have for you is that to observe the scapular movement. So you saw where the muscle goes from the ribs to the shoulder blade. And so if you ask people to do an activity, then you'll be able to see the glide or the movement pattern of the shoulder blade. The third tip I have for you is that I like to then, when I'm palpating the texture, the density of the skin and the muscle, is that I like to see how far in I press before people feel pain. That gives me an idea about the intensity of the problem, and also as it improves. As it improves, I hope that I can press deeper before the pain is sensed by the person. So these are my tips for assessment. Let's have a look at the treatment plan. My treatment plan is that I aim to soften a tight muscle, so soften the serratus anterior. Now, you know that it's not just the serratus, there are surrounding muscles, but serratus anterior, if it's tight, then it absolutely needs to be softened. The treatment plan is also to address any changes in the stretch of the skin at this area. So if there's a reduction in movement of the skin in the directions that it needs to stretch, then that needs to be attended to and normalized. And that I also use stretches, and I use gentle contract and relax and with the aim of getting that shoulder blade being able to come back towards its more normal position or its ideal position, which is down and closer to the spine. And it's when I've achieved these milestones of having a soft muscle and then a working muscle and then an activating muscle, then I will look at engaging in retraining, and retraining with no weights first, and then retraining with weights and resistance second. So now I'm going to be talking about my tips for treatment. And let's have a look at tip number 1. My tip is, do not dismiss the reduced movement in the structures above and nearby, which is the skin and the fascia around serratus anterior. And so we want movement in the skin, and we want movement in the superficial layers. And at serratus anterior, we want movement going up the arm of the structures. We want movement going down the trunk. We want movement of these structures going across the body in the horizontal plane. And that I use conservative treatment, so hands-on treatment, to increase skin and fascia movement. My tip number 2, I use trigger point. And so I like trigger point because my patients can readily engage in that, and that they can do trigger point to this area every day until serratus anterior becomes soft and more like a muscle. And so trigger point needs to be regular, and it needs to be in at least 5 places. So I've got more than 5 places marked there, but just to let you know, because it's a multi-pennate muscle, then trigger point must be done in 5 different places on the trunk. There's great references to trigger point on the internet, and the best book I find is Travell and Simmons on trigger point conservative treatment. Tip 3 is that stretches need to be used daily, and these will help correct postural changes. And so you will investigate the stretches for serratus anterior and apply these to your patient education in your treatment plan. So stretches have to be used daily, and that's because of that underlying problem, is because we're human. Our shoulder girdle is weakened because of the way that we use it. So stretches need to be incorporated into daily practice. Tip number 4 is that retraining of the scapula and the humeral movement must be carefully instructed and then supervised in the treatment session. You will find that people have developed a rhythm problem, so an activation problem, a patterning problem. And so retraining the scapular movement and the humeral movement is a very important part of the treatment. So I just wanted to alert you to the importance of serratus anterior and the skin above it, and give you some ideas on why this area is affected during breast cancer surgery and radiotherapy. And then my tips for the assessment and my tips for treatment. It's not a training program. It's just to alert you to that this area needs to be investigated. And I just figure that when I found this photo, and it was a beautiful photo of this girl doing her quad stretch. And when you actually look up close, you can actually see that her left shoulder, the scapula, is tilting at the lower edge, an indication of serratus anterior changes where it's not working so well. And on the right, it's actually tilting the whole blade. You can see just here the shadow is tilting away from the rib cage, both indications that serratus anterior is not working. And so I figure, someone who looks like they're doing a lot of work and most likely hasn't had breast cancer surgery or radiotherapy, if they have shoulder dysfunction and serratus anterior issues, then it behoves us as therapists to anticipate that there is a likely serratus anterior impairment and that it needs to be assessed and treated. So I know that this has been a short presentation, but really what I wanted to do is highlight to you about the importance of serratus anterior and the surrounding the tissues of the skin and the superficial layers between the skin and serratus anterior, that it is in the hit zone. So it's in the hit zone because of the radiotherapy and the surgery changes after breast cancer. And that we really must be looking at addressing that in people after breast cancer and their recovery. Thank you for watching.